greatest glory is not in never falling, but in rising every time we fall. Well said by someone. Welcome back to the channel Knowledge Star, way to continuous lifelong learning. My name is Anshika Gaur. I'm the Corporate Communication Executive. Today, we have a very special guest, Dr. Sai Kalyan, who is a research scholar, academic researcher, professor, lecturer, editor, and whatnot. Welcome, Dr. Sai Kalyan.
Hello.
All right. So, first of all, tell us about yourself and what made you decided to pursue this career.
My name is Dr. Sai Kalyan. I'm a senior consultant neurosurgeon in Institute of Neurosciences, AAG Hospital, Gachibowli. I come from a medical background, and my dad, being a doctor, he's a professor of medicine, and he headed Department of Medicine in Kannur Government Hospital. And I've seen him growing up because he has trained many residents, and he had a lot of compassion towards this subject, and that made him one of the stalwarts in the medical profession. And I used to see him how the patients used to respect him and how the students used to respect him, and that made me inclined towards this medical profession. And later on, when I joined my MBBS, it's like you feel like when we have passion towards different specialties. But once you finish your MBBS, then I thought, compassion towards surgery made me to take general surgery. And after successful completion of my MS general surgery, I wanted to choose the one which is more complicated. And among all super specialty branches, the neurosurgeon, the neurosurgery, particularly the brain and spine surgery, is a very complicated, and it's not easy for everyone to do. So then I opted that profession, that branch, and I had a lot of interest. I had a lot of compassion. I had a lot of passion towards it. So why is it like this? Why is it like that? And that made me, to get inclined towards neurosurgery. And after finishing my residency successfully for a period of time, I did my clinical attachment in England in spine surgery, one of the reputed institutions, that is the Walton Center. There, the overseas consultant was also very happy with the way I used to ask the doubts, and I had that, this thing that to know the things. So I never hesitated to learn the things from seniors, juniors, colleagues, and everyone. And later I came back to India, and for a brief period of time I stayed here. And again I went to Japan to do my cerebrovascular fellowship. And after successfully completion of my vascular fellowship there, I came back. I worked as a junior consultant in KIMS, later promoted to consultant, and later now I shifted to AG hospitals. And my field of interest are the neuro-oncology, that is the brain tumors, the endoscopic brain tumors. We deal with endoscopy surgery, particularly the pituitary surgery, and cervical spine surgery, lumbar surgery, and spine tumors, spine trauma, and all these things. And I'm trained in microscopy and endoscopy as well.
All right, sir. All right. Sir, what are the common causes of neck pain and back pain?
There are several causes for neck pain. The commonest being the mechanical strain or strain that which occurs, due to many reasons like improper posture, like sports injuries, and all these things. Apart from that, we may have the discogenic pain, which is because of the disc whichever is there in between two vertebral bodies. This comes out and it compresses the cervical cord, or it can compress the nerve root, which causes this radicular pain. And in the same way, we often keep hearing the patient feeling sciatica, sciatica. It is nothing but the pressure over that nerve, and that can be because of the disc, or it can be because of the inflammation of the joint, or any infections may cause this back pains and neck pains like epidural abscess. Tuberculosis can also cause, and some of the tumors of the spinal cord can also cause these pains, and of course the trauma during accidents and post accidents and all these things. But we often see this neck pain and back pain because of the mechanical stress or mechanical strain and the prolonged immobility. I mean, sitting hours together in front of systems,
Yes, yes,
not being conscious about our posture,
yes.
the, the yeah, improper ergonomics, and all these things causes this neck pain and back pain.
All right, sir. Sir, which age
Mm.
group are vulnerable to cervical and lumbar disc?
Initially, we used to think that the old people, are more prone to develop these neck pains and back pains because of this degeneration, which is a natural process which happens, once a person gets older. But nowadays, we often see these pains even in the youngsters, particularly the software people or the one who sit in front of systems for a long time, and we even see it in the young generation people in the, like, post sports injuries, and we often keep hearing from the patients that I lifted heavy objects and I
Absolutely.
had this pain, I had this all these problems. So, which is not being supervised basically in a gym. Youngster who goes to gym and lifts the weight without any supervision, suddenly he develops the neck pain or he develops back pain, and we get the test done, we examine him, and we find out that the disc has come. So it has been common now in there is no as such specific age group. It affects both the young people and even the aged group.
Okay. All right, sir. Do all spine patients require surgery?
Yeah, see, the thing is that when we have these problems, say the neck pain and the pain which is radiating or the back pain which is radiating, initially, it's better to come to a doctor and get examined. Okay, we have a set of neurological examination which we do on the patient, and we'll come to a conclusion. And based on that, we are going to ask for some investigations. There will be a battery or set of investigations. So we confirm it with the investigations, and if it is really necessary, then we offer the patient surgery. But it's and most of the time, 90% of the patients they don't require surgery at all. It's not 95%. There are only specific indications for surgery in spine. So it's better to consult an expert and get evaluated for the same, and then the doctor is going to offer you. So we generally offer different management policies to the patient. Initially, we go with a conservative trial, and if it doesn't fail, then we go for surgery. And there are some indications, like if the patient is having any severe pain in spite of medication, or is having any extruded disc or migrated disc, which is really compressing the nerve. And because of that compression, patient may develop the paralysis and all these things. In that aspect, definitely, yeah, we need to go and get the surgery done. But most of the time, it has to be evaluated initially before jumping into the surgery. Okay. So 95% they don't require surgery at all because it's mostly the mechanical sprain and strain.
Yes.
So the proper evaluation will guide us whether to go for surgery or
Okay, sir. Sir, is it true that
not.
spine surgery is with lots of failure rate?
Yeah, initial days when the traditional spine surgeries where we used to open from uh, whole back, and in those days, yeah, the complication rates were high, I suppose. But with the advent of this new technology and techniques, the spine surgery complication rates have significantly come down. See, now we do the minimally invasive spine surgery, where we use the corridor, which is very minimal, and the tissue injury is also very minimal. And we used to hear from our grandfathers and grandparents that the person who used to undergo spine surgery became bedridden. He was on the bed for a long time. It is not like that now. Early ambulation, post surgery, we do early ambulation, and it has become a daycare. I mean, for recently we did a disc surgery. We admit the patient in the morning, we do an endoscopic discectomy, we ambulate the patient in the evening. Based on his pain tolerance, we are discharging him the same day. And the idea of doing these surgeries is early ambulation, so that the patient can get back to his normal life very early. So the complication rates, as I said, with this advent of uh, techniques and technology has significantly has come down. That is one thing. And second thing is the expertization. The more number of cases we do, the more workshops we attend, the more knowledge we share, and the more normally what I do is I have interest. So whenever a new technique comes, I go to the workshops, I attend the conferences, I meet the experts in that particular field. I clarify my doubts, whatever I have, and I don't feel shy in clarifying my doubts. So, and I come and I go to the literature. So, what are the success rates in it? And then we do, and then we adopt. And by doing more cases, yeah, significantly the complication rates come down. So,
Okay,
the technique is also important, and expertization is very important here.
okay, sir. So, what are the new surgical techniques in spine surgery?
As I said, we are doing nowadays the minimally invasive spine surgery. That it's a micro surgery. It can be done under microscope or it can be done under endoscope. So even we call it as a keyhole surgery or a stitchless surgery. So hardly we take a 2 incision, we pass the scoop inside, we see it in the TV, and without disrupting or without damaging the body tissue like the bone or the ligament, whichever is there. And there is very minimal, very minimal damage to the tissue, and we are going to remove the disc. And the same way we stabilize the spine by putting some screws and rods. So initial days we used to do a big incision, open the tissue like this. It is not like that now. We do it under technique called as a neuro navigation. We have specialized instrument called as O-arm, that is the intraoperative CT scan. And under that guidance, it's something like a navigator, the Google Navigator. So we have got a neuro navigation system with us. So under these things, we are going to put the screws. See, all these things is to minimize the errors and increase the accuracy and reduce the complications.
Okay, sir. Sir, do stem
Hmm.
cells work in lumbar or cervical disc pain?
Yeah, I mean, a lot of studies are going on this, and a lot of research is going on this. And some of the studies, yeah, they are in favor of, they say that yes, when we inject these stem cells, we remove the stem cells and we inject into the disc space. They say that the disc is going to get regenerated. Yeah, but still, multiple studies have to come. And some of the scientists and researchers have tried on this, and they say they have published a successful literature as well. I mean, they said that the this got regenerated once the stem cells were injected into the disc space, particularly the degenerated disc space, and eventually the pain has also come down.
Okay. Sir, we
Mm.
always heard from everyone that for this pain, do this exercise or that exercise. So, does exercise worsen or improve pain?
Suppose see the patient comes to us with a neck pain or back pain. We generally evaluate it, and after doing the clinical examination, we get the test done, and based on that, the latest guidelines say suppose the patient is having a mechanical strain or strain, we ask them to take bed rest for not more than 3 days. Okay, and in fact, we encourage them to go for strengthening exercises, core stabilizing exercises, back strengthening exercises, because the, the exercises, particularly the back strengthening exercises and all these things, stabilizing exercises, the pain threshold, they
Yes,
increase the pain threshold.
yes,
Okay, yeah, definitely it is beneficial. And again, it depends upon the pathology, I mean the disease exactly. Say suppose that the patient is having a trauma, and he had a fracture. In that cases, we are not supposed to encourage the patient to do the exercises unless
absolutely.
until that has been stabilized or that has been addressed. And I suggest all my patients to do swimming, which is a good exercise for the spine.
Okay, sir. So now, what message do you want to give to those who want to pursue this career and who already pursuing in this field?
See, I personally feel they should have this compassion, and they should be having the fascination. Okay, if you take, I mean, when I was a student, and when I took this profession, there were a lot of things to learn. See, this is a uh, never-ending process. Okay, lifelong. You need to read, you need to learn the new things, you need to discuss with your seniors, juniors, and you shouldn't feel shy or this thing. So the one maybe the youngsters who are pursuing this career should have focus. They should be more focused about what they want exactly.
Yes, sir.
Because see, that what was there 20 years back is not gold standard now. Say 20 years back, we never had the Indian system. We never had these. Hardly very few centers had micro surgeries and endoscopic surgeries. Now these micro surgeries and endoscopic surgeries, everyone are doing. That is because availability and the interest of the particular candidate who wants to learn the new thing. So they should have that enthusiasm, compassion, and all these things have to be balanced to be more successful in this profession.
Okay, all right, sir. Thank you, sir. You have shared very valuable information. And
Yeah.
also, thank you for your
Thank you.
time, your support.
Thank
Thank
you.
you for this wonderful interaction.
Thank you. Thank you so much. Thank you so much.
For more updates, subscribe to our channel, click the links shown on the screen to stay connected.